Okay, so today we are going to work with the 3-month supine position, just like the baby that we just saw. We want to be comfortable in this position because so many of our DNS flow classes start or use this as the basis of position. So we want to make sure that we feel very comfortable and even try to work towards a sense of effortlessness in this position. To start, we will use some props. So we'll use the chair and a folded up blanket or towel so that we can have a nice gentle introduction to this position. So we will put the feet on the chair, and the knees and the hips will be at 90 degrees, and the blanket will be folded adequately enough so that the back of the neck can be long. Okay, we want to at this point have the pelvis in a neutral position. Okay, so we are not arched, we're not overly flexed into the table, into the floor. We are in that centered position. And the same thing with the head and neck. Okay, we look at this position as a whole. Normally the arms are relaxed down by your side, but we will use our hands a little bit to get comfortable and get acquainted with the position. It is relatively common that the ribcage may be flaring upwards a little bit. So we're going to do a couple of exhale cycles, and we will gently guide the ribcage down manually with our hands. So taking a breath in and all the way out. And again in and then all the way out. So really assisting the ribcage to come down towards the pelvis and then all the way out. And we try to maintain this position as we take the hands away. We will now begin to breathe around the full cylinder, so around the whole rib cage. If you like, you can place your hands around that lower rib cage and try to get breath all the way into the sides of the ribs and the back spaces of the rib cage where the thumbs are. Staying away from the upper chest, which is a little challenging when I'm talking. And another prompt, if you are finding this difficult to stay away from up here, is to simply limit the breath that is happening up here with your hands by sort of a downward pressure. And see if that can assist you further to get the breath around the whole lower rib cage, which means that we're actively using our diaphragm with our breathing. So to create intra-abdominal pressure, we simply use the mechanics of breathing that widen the rib cage, and we try to maintain that space a little bit with some use of the abdominal wall, even as we exhale. So as you may notice, as we inhale, the circumference increases, and as we exhale, it draws down. So let's try to maintain the circumference as we breathe in. The belly expands all the way around, and we breathe out, trying to maintain some of that pressure. So if you like, you can place, sort of prod yourself a little bit around your abdominal wall and check that it is switched on a little in order to create this tension around the whole abdomen. And we use this to move. Okay, so from here we now have intra-abdominal pressure, and we are still breathing diaphragmatically, not through here. And from here we can begin to move. Okay, so we can offload the limbs and get into the unsupported 3-month position. So one leg here, other leg here. Relaxed in the face, neck and shoulders. Trying to breathe abdominally. And then coming back down. Okay, as we get more comfortable in this position, we can do away with the chair. And to set up the framework before we bring the legs up, we want the pelvis to be in neutral position again. So we can rock forwards and backwards and find the midpoint. Okay, we can adjust the rib cage with an out breath. We are breathing around the cylinder, not in the upper chest. And then we're creating abdominal pressure, pressurizing outwards even as you exhale. And then we can begin to bring up one leg, keep Keep breathing around the center. Increase the pressure abdominally to then bring up the other leg. And relax. So we want to find the ease in the position. It is okay that the hips may go past the 90 degrees position in order to find that effortlessness. If we go sort of to the 90 degrees or beyond, we can feel that we might change the position. So trying to find the ease here in this position. Breathing ventrally, breathing around that cylinder.